What happened? It's okay, yeah, it's okay.
Start again.
Yeah. Hey, good afternoon, media partners. Did you folks hear that introduction before? No, I assumed, and I do apologize for that. Thanks for joining us in this press conference regarding the community cases. Today we are joined with the Governor's Chief of Staff, Will Castro, COVID-19 Task Force Chairman Warren Villagomez, as well as CEO of CHEC, Esther Muña, and the Governor. We'll be going over the community case, the recent community case, the case investigation details. We're joined also with our contact tracing team as well as our epidemiologist. The Governor will make comments, then CEO, then we'll move on to our case investigation details. From there, we'll go into Q&A. Sir, please take it away.
Alphaday Tiro. Again, we're here for this briefing with respective entities. My message to the community is please don't panic. And when I know that there's so many questions, concerns, uncertainties, but one thing that is important to know that the contact tracing department, the employees, they're doing their best, and to wait and not panic, and wait to their calls, whether it's government employees, private sector, or just out in the community. I know that we all want to get tested, but more importantly, at this point, is continue the effort of getting vaccinated. I can't emphasize that again. Get vaccinated. The team is working really hard in getting the contact tracing in. If you are called in, please share all the information that you can. Hiding information will not help anyone. It's actually going to worsen the process, and the people that you're trying to save, you're not actually helping at all. So with that said, I want to thank CEO, the contact tracing team. They've worked day in, day out. And to the families that have contracted, we are praying for you. Those that are under PUI, please continue to practice the W's. I know that some of them are in quarantine, but to the family members and to the community, continue to practice the 3 W's and follow and believe in the right messages and the right medias. Following through, we have right media partners. They disseminate the appropriate information, and let's believe in those messages and information. Again, thank you.
Thank you, Governor. Oh, someone waiting in the lobby? Okay. Okay, so I'm going to go down. Okay, great. So I'm going to go down the information with the in regards to the active cluster and case updates. So our first cluster, on Thursday, October 28th, the first case in the cluster was identified through routine school-based screening as a student at a middle school. Contact tracing led to the identification of multiple instances of household transmission to family members and close acquaintances in multiple households. The earliest onset of these cases linked to this cluster is October 7, 2021. To date, there are a total of 12 cases, 12 for this cluster, 12 are household contacts to another case in the cluster, and 12 are in isolation at Canoa. Close contacts were identified at the school, workplaces, households. Close contacts and guardians are in quarantine at Canoa Resort. First day of 5-day test out is November 2nd, 2021. A second cluster is, as the summary for this is on Thursday, October 28th. The first case in that cluster was identified through routine school-based screening as well as a staff member at a middle school. Contact tracing led to the identification of household transmission to family members in 2 different households and workplace transmission. The earliest onset of cases linked to this cluster is October 20, 2021. To date, there are a total of 9 cases from this cluster. 9 are household contacts to another case in the cluster. 2 are workplace contacts to each other, and 9 are in isolation at Kanoa. Close contacts were identified also at the school, workplaces, and households, and their guardians, themselves and their guardians, are in quarantine at Kanoa. And the first day of 5-day test out is on November 2nd, 2021 also. We have found cases that were unlinked to the 2 clusters. There are a total of 5 unlinked community cases, and this again could change. 2 are household contacts to each other, with the first case identified on October 29 through the community-based testing. 1 case was identified on October 31st through community-based testing, and 2 are household contacts to each other, with the first case identified on November 1st, 2021 through today. The active cases in border quarantine right now are still showing 2. 1 case was identified on October 23rd, and the other case was identified on October 29th. And we'll go ahead and turn it over to Stephanie.
Carnally, I am the Regional Communicable Epidemiologist with our Pacific Island Health Office Association with PIHOA. I have been deployed to CNMI to assist and provide epidemiology services. And so today I'll be sharing a short report, providing a case breakdown and some more details about our current active cases, of which there are 28. So just bear with me for a second while I share my screen. Thank you very much. Okay, I am sharing my screen now. Can people see the screen? I am seeing yes. Excellent. Okay, so here is our short summary for today. Our total case count for the CNMI, 318 cases, as you all know, I'm sure, with 3 COVID-related deaths. We currently have 28 active cases that CEO Munia just went over the cluster report for, as well as the 2 border quarantine cases, and no current hospitalizations of COVID-19 cases. Since Thursday, October 28th, when we saw these first cases appearing, we have seen 27 new cases since then, 19 of which have been identified through contact tracing directly. 7 of which were identified through community-based testing, and 1 of which is from travel testing. Of those 7 identified through community testing, 2 of them have been linked to clusters identified in the contact tracing, as CEO mentioned. Below this, we can see an epidemiology curve, which just shows the cases by the date of symptom onset. Majority of our cases are symptomatic. Most of them are experiencing mild symptoms. And the first date of onset for these new active cases, you can see here, is October 7th, which was linked to a cluster, as CEO mentioned in the cluster report. We see a gradual increase in cases over time. And as we are detecting them now on the 28th, 29th, 30th, and 31st. These are all mainly found through contact tracing, which really highlights the great work that our team has been doing, the importance of sort of backtracking, understanding that the cases are going to pop up a couple of weeks later after exposure. In addition, I can provide a short demographic breakdown of the cases, our current cases, active ones. We have a very even split by sex, about 50-50, with 14 males and 11 females. Age groups, majority of our cases are in the 20 to 49 age group in the center, and 8 of them are under the age of 19, are younger folks. That is reflected in our vaccination status of these cases. 70% have been fully vaccinated, and we're seeing breakthrough cases. But a quarter of them, of these cases, are ineligible for vaccination. These are our younger cases under the age of 11 who are not yet eligible for vaccination. And 2 of the cases are unvaccinated. Finally, we can see, based on our report date down here at the bottom, these are the days that the cases were identified by test date, that they were resulted. See, most of our cases were identified on the 28th and 29th. And we see that the majority of them are linked with those 5 unlinked cases, 2, 1, and 2 that are unlinked currently to these main clusters, as well as our single travel case. We see the majority of them are linked to our clusters that we've identified, and for those that are unlinked, they have 4 of the 5 have a contact to another case, usually to each other. So that's a basic breakdown. We're seeing a really excellent contact tracing work, very heavy lifting from our team here that have identified the majority of our cases and been able to link all of these cases together. I'll turn it over to Dwayne for any additional contact tracing updates, and I'll stop sharing my screen.
All right, good afternoon and half a day team. This is Dwayne Davis with the CHCC's CNMI Task Force and collaboration with the CNMI Task Force contact tracing team. So basically, yes, Stephanie has pretty much covered the reporting process of the numbers that we've been identifying. Teams have been working 24/7 around the clock to ensure that we continue to identify any additional PUIs and close contacts of active confirmed cases. We do want to share that there is concern out there in the community with regards to exposure, adding on to what Governor has shared. If a contact tracing investigator and inspector does not reach out to you, you are more than welcome to contact our tip line, which you can share the numbers with our media partners. Individuals can contact the tip line and get additional information from there. Overall, if you did not receive a call or you are not contacted by an investigator, that could mean that you do not have any level of concern at the moment. Should there be a level of concern, an inspector will contact you and conduct interviews to ensure that assessment is properly done and your level of risk is identified. Again, we are going to continue to work together with the Governor's Task Force, as well as the support and guidance from our MP, who is Stephanie. And our overall goal is containment, linking, and additional identification if needed. Thank you.
So the messages at least from we want to have for the community is, again, if you haven't been vaccinated, do vaccinate, get the vaccine. Get your booster shot if you're due for one, 6 months after your Pfizer and Moderna, and 2 months after J&J. Multiple studies have shown that antibody levels are associated with protection in the community, but individual antibody levels vary. And so this is why it's important. When what we're seeing right now with 80%, over 80% of our that are fully eligible have been basically fully vaccinated. That is key, again, especially with the antibody levels vary by individual. But again, with that, having a community level of vaccination is important. If you have symptoms, see your provider. We have presumptive eligibility for Medicaid here in the CNMI. We have got that approved that basically anybody walking through the ER will be presumed eligible for Medicaid. And so there is no barrier for you to access care. We're urging you, if you need to see a provider, please do so. And the mild symptoms of COVID are fever, chills, shortness of breath, nausea, headache, vomiting, and loss of taste or smell. So please look out for those. Getting vaccinated, again, fulfills our public health goal of reducing the risk of infection, severe illness, and death. And the screening that we have put in place, we are still at a low transmission. And it is, what we have done, though, has gone beyond that. Responding with our testing is basically, with now the recommendation from CDC, for example, with a low transmission is to test only symptomatic individuals. What we have done, and we have continued to do this since the beginning, is that we do have testing for close contacts, which basically is the contact tracers. That's what they're doing now, and they've been identifying those cases. And then we also are looking at, with the community-based testing. And so we have all these testing strategies that are in place beyond even the fact that whether it's a low transmission. We don't want to get to moderate or substantial transmission in this community. And so we are grateful for that. At least that's what we're seeing right now so far. And I'll be here too. We're here to answer questions. Yes.
All right, media partners, we're going to be turning it over to you folks. I'll call you one by one. Just want to remind you folks, this is a briefing regarding the latest community case investigation. We will also brief the media and the public after the investigation is completed. Josh, you first.
All right, can everybody hear me? Are we good?
Yes.
Okay. My one question for now, this is for Chair Warren, Governor Torres, and CEO, if possible. So it was mentioned earlier that there are 5 unlinked community cases. So can we just get like maybe a scientific explanation on how that would happen, I guess?
Contact investigation has to occur, basically. We have to do investigation on these cases, and we will determine. The reason why they're unlinked is because they're just determined.
All right, thanks.
All right, moving over to Kay. Kay, you'll have to unmute yourself. All right, we'll move on over to Maureen. And Maureen, you'll have.
Good afternoon. Can you hear me?
A little bit, Maureen. We're getting feedback from you.
Okay, I'll try.
You can't have 2 devices.
There you go.
There you go.
There you go.
Is
Now we
that
can
better?
hear.
Yeah, that's better.
Okay, so at this point, do you feel that the numbers are spreading and accelerating? Is it too early to say that that you're containing the community spread?
Maybe we'll have our Stephanie can, yeah.
Stephanie, can you chime in?
Sorry, I think we're unmuted now. Hello, everyone. Yeah, I'll go ahead and take that one. Our evidence of transmission does not indicate acceleration in terms of our curve. Everyone knows about flattening the curve. Our curve does not indicate that currently. I think very obviously we have seen a lot of testing in the past couple of days. We have not been seeing our cases skyrocket. In fact, we're seeing fewer cases identified each day. Our bulk of our cases were identified on the 28th and 29th, and we've been seeing 1, it's been 3, then 2 cases so far today that we've been identifying. So no evidence so far of accelerating transmission, likely tied to the high vaccination rate. With a large number of immunized people in the community, we're able to get close to that herd immunity, which can help break the chains of transmission. So we're not seeing any evidence of accelerating transmission as of right now.
Okay, thank you.
All right, Sally. Sally, you have to unmute yourself.
Hi, good afternoon. Sorry for the delay. My question, I actually also got on the press conference a little late, but just to reiterate, I'm sure that Governor mentioned this. What are our plans moving forward with all of this new information and development?
Well, we met with PSS over the weekend. We have more protocols and some requests to on faculties, and that will give us this whole week to work with PSS and hopefully resume after that. But in terms of the government, I don't plan on shutting down any of the government. I am relying on the result from the COVID task force as well as the contact tracing to finalize their report, and they will make the proper decision after that. Again, it's important that our community understands not to panic. We have good people, hardworking folks at the contact tracing. They are doing what they are supposed to do. So we don't have to, again, create a new protocol until they finalize their reporting. Again, I cannot emphasize enough to all our government employees, our private citizens, our business partners, until you get a call from the contact tracing, you need to continue you need to continue to come to work and live your life and continue with the 3 Ws. That is the critical part. Those that have not been vaccinated, again, we encourage for you and your family, your loved ones, go get vaccinated because that will help the community again.
All right.
Thanks,
What about in terms of socializing over the weekend and today? There's a lot of people gathering together. Is this encouraged, or how do we go about this?
Well, what our encouragement is to continue to practice the 3 Ws and the task force and the contact tracing is doing their job in making sure that those that have been contacted with a positive are being brought in as PUIs and they have been isolated. Again, we're not going to go out there and say, continue to celebrate. Again, what we're saying is we're updating you the information, but continue the 3 Ws. COVID's not going to go anywhere, not anytime soon. So we continue to vaccinate, we continue to practice our 3 Ws, and listen to the right information to the right social media outlets.
Yeah, your best defense is vaccination and masking up. So where you can enjoy, getting together with others, that's fine. But again, it's the vaccination. That's one of the reasons why we're rolling it out, and we're looking forward to getting the decision from CDC about the vaccination of 5 to 11. And like the governor said, we met with DSS, and we are going to work with them to try to roll it out as smoothly and as quickly as possible.
And Sally, I want to just add a little bit. I know there's so many different advices left to right. Do this, do that, don't do this, don't do that. Again, we've been through this since day one. We have the right folks, the right professionals that truly cares about the community. So before doing any drastic changes, we listen to those, we get the information, and then we sit down like we are doing today, and then plan out what is the best course of action.
Sally, I'd like to add a very good question. Are we encouraging gatherings? Let's make it a holistic community effort. Make it a win-win. Let's ask ourselves, ask our loved ones, are they vaccinated? And if they're not, please convince them to get vaccinated. Thank you.
All right. Thank you so much. That's all the questions I have.
All right. Thanks to our media partners in Guam. We'll get to you right now. Tomas, you have the floor.
Hi, good morning, everyone. I just wanted to start with a question for the epidemiologist, Stephanie. It's only been about 4 or 5 days out since this first identification happened. When are we going to get to a place where the data is solid? Is a 7-day rolling average more important? Is a particular testing rate or number especially critical? Can you provide some of what you're going to need as the epidemiologist on the ground? Because also it would be great to get the testing numbers every day, but I believe like on Friday over 400 were tested. Is that a good rate to be at on the daily testing? Could you provide a response to what type of data you're going to be looking at and when we can be completely confident that the contact tracing is finished?
Sure. We have a couple of different data sources that are useful for us to look at in order to kind of monitor the heartbeat of this infection in the community. And so one of those is testing, absolutely. We want to make sure that we are testing enough people and that we are testing a wide variety of people, as well as being able to target our testing to our highest risk groups, right? We don't want to be testing kind of willy-nilly all the time. So one of the things that's very critical is making sure we have targeted testing and testing availability for our community to access should they need it. If you're symptomatic, like CEO Munoz was mentioning earlier, if you're sick, go see your provider. Make sure to be monitoring yourself for those symptoms of COVID. Cough is a very common sign of it. CDC provides a nice list of symptoms, so making sure that people are monitoring that. We also have syndromic surveillance in place here in CNMI to monitor how often we see people showing up at the ER or clinics with those signs. We call it COVID-like illness. We have syndromic surveillance here in CNMI that we do use to monitor that situation. And if we do see spikes in that, we can kind of get that underlying heartbeat on what's going on in the community that maybe is going undetected, right? As we all know, COVID-19 can be frequently asymptomatic. And so even though folks aren't showing symptoms, they may have a family member who does, and we can find those cases that way through making sure that people are able to access those. But yes, testing data, our case data, it's only been a couple of days now since we've had sort of daily testing. We usually do it a little less often. But one of the, I think the key tests here, the sort of one that really kicked it all off is our school-based testing, which has been shown to be a pretty big success, I think, in being able to help us identify quickly and help our teams quickly reach cases that, as we can see, can be in large groups in our clusters. So we have a couple of different excellent testing strategies we are putting in place to be able to do that. And so those are some of the important ones in terms of the data.
Given everything we know, how should we be testing every day?
Any recommendations now on the testing every day, but I just want to make sure that the testing, I think one of the important things is to make sure testing is available to those who need to access it first and foremost. And we have that availability already through our clinics for those who are our highest risk for accessing testing through CHCC. So definitely making sure we're having our tests available for that and keeping an eye on that. So far, we're seeing a pretty low positivity rate by day. Currently, we're having a really high turnout. Our community is very engaged in getting tested. And so we're seeing lots of tests and not a lot of cases, which is an excellent sign for us. But, we're not testing everybody every single day. So, there are, things we're still trying to reach as many people as we can. Thank you.
Media partners, I will send out testing data after this brief.
Okay, thank you so much. And then my second question is for Governor Torres and Chair Warren. I'm sure you've seen people ask why only shut down the schools and colleges. Can you respond to that question? Why only schools and colleges, given that even though they might be quote unquote classified as a household contact, these are people who go to work, who go to other places that can be similar to a school setting. So what's your response to those who say, why is it a targeted closure of schools and colleges?
Well, again, this is through contact tracing. I've been identified at the school. And so we listen to that important information, discussing this with contact tracing, the task force. It's important that in the beginning, even with PSS, they were only supposed to shut down the two schools, which is Chacha and San Antonio Middle School. But when we found further information that included Morelos High School and Northern Morelos College, that's when we shut down the whole entire education system. So that's the rationale.
But I think can I just go ahead and kind of throw in there, even though you didn't ask me? We did, like the governor mentioned, we did discuss this with PSS, that there is going to be, there's how to handle this, I guess, in the future as more, we work with them. So we want to make sure that there's a understanding of what's the next, because may not be the first and last time that we're going to have this, right? So we just want to make sure that we have a system in place eventually.
And so Thomas, just to add on that too, our system now is good, but the system that we have is in the future as well. We may not even shut down the whole school. We may just bring in the individual in the classroom, maybe just a classroom, to shut down just a classroom. Again, it's important to understand how much effort we're putting into having our students, our kids get vaccinated. It's not just protecting the community, but individually. Hopefully the next week, we would be having an opportunity to vaccinate even younger age. So that's the rationale.
And CEO Munya, do you have any update on the index case? Are we getting any closer, given that, and also my second follow-up question to that is if quarantine is going to change, but just first, if there's any update to getting closer to the index case, given that it's been celebrated of, over 200 days of no transmission, are we getting closer to finding that out?
Well, we're getting a better picture of our cases, right? So that's one of the what I've shared with you all is the different information about the clusters, and so we have that information, and we're trying again to see how it all links together, or maybe has no link at all. We want to be able to complete our testing and our studies on this. So at this point, unless Stephanie wants to chime in on that as well, did you?
Yeah, sure. I'm happy to. Yeah, so we're currently underway in backwards contact tracing, trying to identify that source case. And as the farther we go back, we're more and more limited by the memories of our cases. As someone asks you what you were eating for dinner yesterday, it's already hard. Now imagine trying to ask who you saw on a Friday a month and a half ago. So we're getting a little bit limited by that, but we have, as we saw from our contact tracing data and from our cases, we have traced back all the way to the beginning of October for our current clusters. And so we are continuing to move further and further back to try and identify as far back as we possibly can, knowing that, infection resolves at some point. We can't test somebody for positivity and, were they positive on October 1st? Oh, we don't know. They weren't then, and they may not be now. So we have to do our best with the information we're getting now. So that's why we're expanding our net slowly and surely to make sure that we're identifying as many, high-risk contacts who are most likely, and identifying that index case as best we can. But so far, we've really pulled up the route. We're really seeing the clusters from our index cases identified mainly through school-based testing. So that's been really successful. Thank you.
And also just wanted to ask real quick, is there any threat to rodent or Tinian?
To Rhode and Tinian, no, we do ask the questions about any connections to Rhode and Tinian, and at this point, we do not have any connections to Rhode and Tinian.
And then my last question is if quarantine is going to change anytime soon, the entry protocols.
We will assess it as soon as we complete this investigation.
All right, thank you. That's all for now. Appreciate it.
All right, thanks, Tomas. And real quick, we have Shane Healy from the PDN. Shane, you have the floor.
I have no questions. Thank you.
All right, thanks for joining us, Shane. And last reporter, we have someone from TNC.
Yes, thank you. Sorry I was a little late, but my question is, aside from the closure of the schools, do you plan other precautionary restrictions, like for instance, limiting occupancy rates for restaurants and bars, or limiting the number allowed for gatherings? For now?
No.
Let's just go back to the schools, and I mentioned about the having, everybody having different antibody levels. It's hard to tell that, right? But we do know that this community is has a high vaccination rate. So, unknown. If you don't know what you have, right there, the day one, the decision to close may have, it's an immediate reaction to a situation where you have the majority of that population possibly unvaccinated. But here we are now, we're getting clearer picture getting more information about these cases. And so the decision to close down anything else really doesn't, based on the data that we're seeing, I don't think that I'm looking at that.
But because we pushed so hard to get our community to get vaccinated.
Yes.
We has put so much resources in putting Route to 80. Just my office alone contributed 100,000 to push to that end to get our community at 80%. So there is an incentive for the community that pushed so hard to get vaccinated. So we don't, unless things change drastically, we don't plan on shutting down anything else other than this 1 week for PSS to get back and to do further vaccination and to close the contact tracing report.
Mm-hmm. Yeah, and we did see a high number of vaccinations from Friday and also Saturday. So we've never seen that number before in quite a long time. So it's good to see everyone out there getting booster shots and getting their first shot.
And we also have a very obedient community, we're adhering to the 3 Ws, wearing the mask, hygiene practice, and keeping the distance from each other.
All right, folks, we're going to go ahead and wrap up that media briefing. Once again, we'd like your participation in reassuring the community that contact tracing will continue until all leads are investigated. And again, we will do a post-op briefing regarding what we have found and what next steps will be. And I will send you folks testing data after this brief once we hang up. Again, thank you folks for joining. Please stay safe out there and follow the 3 Ws. Thank you.
I think we're